This Chat with the Experts is brought to you by Angie's List on 93 WIBC.
Welcome back to Chat with the Experts, brought to you by Angie's List. We're having a great discussion today with Dr. Scott Renshaw of IU Health. And we've talked about preventative care and stress management and what you can do to take care of yourself and prevent major health problems. And we've got more to come in just a moment. We're going to take some of your listener questions, but first we want to take a look at what's trending. We've talked a lot about the negative effects of stress today, and if you find yourself at the end of a frayed rope, whether it be due to work or relationships or other circumstances, there are things that you can do to regain your cool. And as we've discussed, prolonged stress can lead to some pretty serious health concerns. And Angie's List writer Michael Schrader has put together some helpful information in an article titled How to Handle Stress Like a Pro. And for starters here, Schrader advises to breathe deep. Dr. Scott Renshaw mentioned that a little bit. It can actually help. Even between some of those hectic meetings you have during the day, you can take deep breaths and lower your blood pressure. A large compounder of stress is a lack of sleep, which can be burdened by the fact that stress also causes sleep problems. So you can attack this predicament from both ends by giving yourself the opportunity for at least 7 hours of sleep each night, as burning the candle at both ends is a surefire way to keep your stress well fed. Additionally, do what you can to find support from friends and family. That's a huge part of it. Check in regularly with those that know you best and get their perspectives. And you can also take action in regards to your health by eating well and exercising, both of which can help alleviate your stress symptoms. And finally, talking to a mental health professional can also be a huge benefit to many, especially those that find their stress exacerbated by mental health issues such as depression. There are many more healthy and helpful ways to deal with your stress and find peace. So you're not alone. There is help. If you want to read more on the subject, you can read Michael's full article and many other pieces that we have on the subject by going to angieslist.com/articles. And of course, talk with your healthcare professional, get their opinion, and find the help you need. That's what's trending for this week. And now it is time to turn to our listeners and get their questions. We call this Consumers Ask, and every week on the show we take questions from Twitter, Facebook, and our online Angie's List Answers Forum to get some questions for our guest, and in turn, get you some answers. And today we are turning to Dr. Scott Renshaw. Dr. Renshaw, are you ready to take some questions from these folks?
Sure.
All right. Let's get started with a question from Joel. He's asking how the Affordable Care Act has affected things like preventive health care and other services. Is it easier to get those services now?
Oh, sure. I think the Affordable Care Act definitely made preventative services easier to get. Again, most insurance plans will cover preventative services. Again, like I spoke about, the key is to kind of tease that out and make sure you know what your insurance covers before you go to the doctor.
Yeah, that seems to be the recurring theme here, is getting that understanding
Right.
before you walk into the office to kind of know what you're going to be paying and what you can expect. Max says that he routinely battles high blood pressure. What are some simple ways that he can control that issue?
Sure. Well, Max, there are a lot of ways. A lot of it is eating healthy. So some people are very salt sensitive, so lower sodium diets can help a lot. Exercise, if you're healthy enough for that, can definitely help lower blood pressure. Meditation, reading, relaxation type techniques can also lower blood pressure.
Yeah. Exercise is a recurring theme as well. It's something that comes up a lot in being something that can help, whether it's stress, dealing with high blood pressure, other things. And I think a common response is, well, where do I find the time for that? What do you tell somebody in that situation? Because it seems, I know in my life as well that, if I actually do make it a priority and find the time, it is beneficial. So,
Right.
It is. It's just like, how do you take those first steps?
Yeah, it's hard. I don't know. Some people say that start simple, like park at the farthest spot away from the from the office and walk across the entire parking lot, twice a day. Maybe that's your start.
Yeah.
Park at the top of the parking garage and take the steps. Don't take the elevator. Don't use the elevator at work. Things like that.
Yeah.
Don't take the shortcuts. Walk downtown to the Starbucks. Don't drive downtown to the Starbucks to get your coffee, or
Right.
those kind of things. So it doesn't have to be a lot. Just 4 or 5 minutes here and there can be very, very helpful.
Yeah, absolutely. Yep. It's definitely good to start small in those cases.
Sure.
I know I've tried to. I'm going to go run 3 miles today.
Yeah, that doesn't work. You're shooting yourself in the foot. That doesn't work.
Yeah. Carla wants to know some tips for handling cholesterol. Are there foods that she should avoid and stay away from?
Well, sure. Yes. Deep fried foods are typically bad. you can deep fry shoe leather and it tastes good, but you shouldn't eat it. Anything deep fried is bad, right? State fair food, probably not the best thing to do if you're on high cholesterol. There are some over-the-counter herbal supplements, some omega-3 fatty acids, some things, but those you need to talk with your doctor about just to make sure there's not going to be any interactions with your other medications.
When you mentioned fried food, that was the first thing I was thinking. I was like, it's state fair time. I can't imagine how many people are consuming, and in one instance, if you're not eating a lot of fried foods, maybe it's not a big deal, but if it's a problem, it may not be one of...
Well, and I tell my patients, one time a year you have your corn dog at the state fair. That's not going to hurt your cholesterol. Now, if you do that every week, we need to talk about that.
Yeah.
The one time a year, enjoy your corn dog and don't tell your doctor. No, I'm kidding. No, I'm kidding, no.
Do you eat fried foods when you go to the fair?
I do, yes. Anything deep fried on a stick is delicious.
Okay.
Yes.
Excellent. Yeah. Shayla's asking about the benefits of aspirin. Is that something that she should be taking every day? And I know I can see on your face already this is going to vary depending on...
Yeah, it is. It's going to vary on your other medical conditions, your age, your risk factors, if you've had a heart attack or if you hadn't. So that's a hard question to answer. That's a one-on-one type question with your physician.
Yeah. Am I wrong in saying that it used to be a thing where it was just kind of, take an aspirin every day, there's going to be these long-term benefits, and it wasn't really differentiating between people's situations?
Yeah, that's correct. But now we found out that was causing more harm than good. So now it's very directed and specific who benefits from aspirin.
Do you feel like some of that misinformation is still prevalent in people you see, or are people kind of getting a better handle on how to handle something like that?
I think people are learning to ask when they don't know. Yeah.
Jerry has heard that multivitamins may not be all that beneficial. Do vitamin supplements actually offer any benefit, or is there a right way to go about it?
Yeah, it's hard to say. There are some very specific medical conditions. People do have vitamin deficiencies. In those cases, you need them. But as a whole, if you're eating healthy, most of our foods are fortified with vitamins. And if you're eating fresh produce, they should all have vitamins. So most people would not need extra vitamins. Yeah. But I know some people take them and they say they feel better. Our body's really good at keeping what we need and getting rid of what we don't need. So again, that's probably a specific question to ask your doctor.
Yeah, we talked before the show about, Mom always, placing the vitamins, by the silverware at dinner. It almost sounds like it's more of an individual basis where you might talk to your doctor and know specifically this is a supplement you need to take, as opposed to just going to the store and buying different supplements that you think are going to be a good fit.
That's correct, right. So,
we had several questions related to shots, getting your child's vaccines early on, and people, there's been a big debate lately, and so having a doctor in the house, we thought we'd go ahead and bring that up. If anybody's has a newborn and are working through that, maybe they've heard some things that are scaring them about getting some of those vaccinations. What are your thoughts on that?
Yeah. Well, I recommend vaccinations. My kiddo's now 18 months and he got his vaccines. The idea of vaccines is to prevent the particular disease, right? And everybody's going to react differently to immunizations, and you can't predict how people are going to react or if they're going to have a bad reaction. But when you look at things as a whole, the vaccines do what they're supposed to do. They do prevent chickenpox. They do prevent measles. So that's what we really push for.
Yeah. Have you found that more people have been asking about that in the past few years? Is that or a lot of people just already just going straight for it? They know they're going to get the
No, I have probably a lot more parents are asking about kind of alternative vaccine schedules, so kids aren't getting quite as many in one visit, and they're being spaced out a little bit differently. And then I have some folks who have decided certain vaccines they're just not going to do. Yeah.
So it's like an alternative plan of like spacing the vaccines
out.
Is that just as effective as getting all of them up front, or?
Well, that's a hard question to answer, because the folks that monitor all this and put out those vaccine schedules say this is kind of the optimal way.
Right.
So that's what we recommend. But then these other, the other ways are probably just as good. We just don't have the evidence to back that up as much.
Well, thanks for speaking of that. That's going to do it for our Consumers Ask segment today. As always, if you've got a question, you can find us on Facebook, follow us on Twitter, and visit our Angie's List Answers forum. If you go to answers.angieslist.com, it's an entire forum to ask your questions about anything, whether it be home improvement or health. We have health providers, we have contractors, and other homeowners on the board there that will offer their feedback, and it's a good way to kind of start a discussion if you're having a question about something related to your home or your health. So check it out at answers.angieslist.com. That's going to do it today for Dr. Scott Renshaw of IU Health. Dr. Renshaw, thank you so much for coming back on the show. We always appreciate having you on.
You're welcome.
That's Dr. Renshaw, but we're not finished just yet. When we come back, we're going to welcome Cynthia Wilson onto our Writer's Block segment. We're going to talk about a recent article package on cancer and how to get the support that you need. So keep it right here. You're listening to Chat with the Experts, brought to you by Angie's List.
Angie's List believes that hiring great local service providers should be easy. Whether you need a plumber or a pet sitter, you can find one at angieslist.com. See ratings and reviews in hundreds of categories, shop popular offers, and request scheduling assistance directly online. Memberships start at just $9.99 per year. That's less than $1 a month. Join today and get 40% off with promo code WIBC40. Visit angieslist.com to sign up.